You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. No more dentures, according to my first guest. We have here an expert on the topic, Dr. Jacobs. Dr. Jacobs, welcome to the program.
Nice to be here.
All right, now before we get into today's topic, and a lot of questions about dental implants, you brought some models. Tell us about your practice. I mean, who's your typical patient?
My practice is a typical dental practice where we see every kind of patient. It's like going to the mall on a Saturday.
All right.
So many different types of people in the mall. That's the type of patients we have. We have school teachers. We have 9-year-old children. I have been the dentist for many of the San Antonio Spurs. So
oh, really?
We have a very wide variety of patients.
Okay, now how long have you been a dentist, by the way?
1983, I graduated from dental school.
When did you know you wanted to be a dentist?
High school.
You knew you wanted to be a high school?
I
now,
did.
Why is that?
I did. I was kind of inspired by a couple of my science teachers and just decided I wanted to go into the medical field, and dentistry is the way I decided to go.
So you do just about everything in your practice then, as far as procedures?
I really do. I do fillings, I do crowns, I do root canals, I do wisdom teeth. Pretty much if you go to a dental office and a procedure needs to be done, we can do it for you.
You know what I like about you on the phone? You say, could I mention, we were talking in the green room, could I mention that people actually want to work with our office? That means that people like working with us? Tell me about that. I mean, you have a waiting list, you say.
We really do.
Okay.
I have been in practice with another person, my partner, who I actually went to dental school with.
Okay.
He was in practice for several years before we joined up, and we have always had the philosophy that we want to treat our employees like their family.
Okay.
And over the years, we've just had a huge response to that, and hardly a day goes by that we don't get a call, somebody asking us, can we go to work for you?
So the word's on the street that you guys are fun. Everybody comes on my show and says they have a friendly staff, but you actually believe it, right?
No, it's true.
Which I like.
I don't need to believe it, it's true.
Do you still hear from people, Doc, no offense, but I don't like the dentist?
Absolutely, every day.
You really do? They say
every
that?
day.
How do they say it?
Well, in the practice that I was with for many, many years, our slogan was, we cater to cowards. And I cannot,
we cater to cowards?
We cater to cowards. Okay. And I cannot tell you how many people say, I came to your office because I'm a dental coward. And they found that after seeing us for many years that they weren't a coward anymore. That going to the dentist wasn't a turmoil. It was something that, they didn't really enjoy, but they didn't hate.
Okay, very nice, very nice. Now, at the top of the show, our topic is dental implants. No more dentures. Get a fixed set of teeth in just a few appointments. How long have you been in and around dental implants?
I started doing dental implants in 1985, so I was out of dental school for a couple of years. I had a surgical background because I finished dental school in 3 years, and it was a 4-year program.
Okay.
So I spent my entire senior year of dental school in the hospital with the oral surgery residents, taking out teeth, going to the operating room, staffing the emergency room. So when I got out, I had a surgical background, and that sort of naturally led to doing dental implants because it was kind of new, just getting introduced.
So what's changed? I mean, what's made it to where what used to take, with dental implants, what used to take 9 months, 12 months, now can happen in just a few visits?
Many things have changed. The primary thing that's changed is our experience in doing dental implants.
Okay.
In 1985, when I started doing dental implants, our whole guidance was by a paper done by a doctor named Brannemark.
Okay.
In Dr. Brannemark's study of 20 years in Sweden, he said that if you do dental implants on the bottom jaw, you got to leave them for 4 months. You do dental implants on the top jaw, you got to leave them for 6 months.
Okay.
We didn't know enough about dental implants to say that's not right. We can leave them a little less, or we got to leave them more. We just went by what he told us to do because he had a 20-year history of them working.
Okay.
So we've also learned more about the jaws through 3-dimensional imaging.
Okay.
I can now see a computer printout of exactly what your jaw looks like, where a dental x-ray is 1-dimensional, shows us how much bone you have this way. 3D imaging shows me every bit of bone you have from every different angle. I can simulate putting dental implants into the model on the x-ray, so it'll show me if I want to use an implant this long and this wide, will it fit? Yes, no, maybe not. So we just have a lot better information.
So when we say no more dentures, I mean, is the future of dentistry, in your opinion, that all dentures or something will be hooked on the dental implants?
I think that's a definite possibility. I think the more that insurance companies start paying for these procedures and they become much more affordable, that let's face it, every patient today that has a denture would be better off with dental implants and something fixed in their mouth. They would all have it done if I gave it away.
Okay. Would they really, though?
Absolutely. I mean,
Okay.
some would be afraid because there's many conceptions about dental implants that they're painful.
It sounds painful.
That it's a lot of surgery.
Is it painful, by the way?
You know, it's really not.
Okay.
It is truly amazing. I do a lot of procedures. I do root canal, I take out wisdom teeth, I remove single teeth, and I can tell you that all of those procedures typically have more post-operative pain than a dental implant placement.
So a dental implant, it's not, I mean, the bone doesn't have feeling, so they don't feel it.
That's correct. We make this little bitty incision in the gum.
Okay.
We open up the gum. We screw this little screw down in there. We put one stitch to close up where we opened it up. And that's just not a real traumatic procedure.
Okay.
You know, pulling a tooth out and leaving a big hole in your mouth is more traumatic than...
So pain is not something they complain about?
It's not.
With dental implants?
It's really not.
Okay. Now, in San Antonio, because I looked on the internet, I knew you were coming, right?
Yeah.
And 20 million Americans, upper or lower denture. So there's got to be tens or at least thousands of people in San Antonio.
Absolutely.
With dentures.
Sure.
If dental implants are as good as you say they are, okay, no more adhesive, things like that, why aren't they all doing it?
Well, I think with the denture wearers, you've got a group of people that have nothing but bad experiences at the dentist. First of all, they had gum disease. Then they had to have all their teeth pulled out. They probably suffered for years before they had their teeth pulled out because it's mentally traumatic to go to the dentist and say, let's pull my teeth out.
Interesting.
Many people feel like I wanted to get all my teeth out because I was just tired of them. Then once they got their teeth out, they think, I'm done with the dentist.
Okay.
I don't have to go back anymore. So 7 years later, they might go back and get a reline because their denture's gotten real loose. So they're either dental phobes, they don't go to the dentist anymore, they think they're too old.
So nobody's suggesting it to them.
And cost. I think most of these people think that dental implants are very expensive. They think, God, I'm missing all 28 of my teeth. To get 28 dental implants and 28 crowns on top of them is going to be enormous. But what people don't realize is, just because you've lost 28 teeth, you don't have to have 28 implants.
Is it true? I mean, with just 2 implants?
Absolutely.
Like snap in, snap out?
Let's just picture you're going on a picnic on a windy day.
Okay.
Okay? Your denture is the blanket you lay on the ground. If you put nothing on the blanket and wind blows, that blanket's going to move all over the place.
Okay.
If you put 2 stakes in that blanket, which is the equivalent of 2 implants, well, that side of the blanket's going to be very secure. The other side might flop up and down. Okay? If you put 2 stakes on this corner and 2 stakes on this corner, which is the equivalent of 4 implants, that blanket's not moving. So most people have a denture that's a blanket that's flopping around.
Now, do you think that well, and my original question, if it's so good, why aren't they all doing it? So they just don't know their options. I mean, denture wearers don't realize that with 2 implants, their whole life has changed. I mean, can they eat, though, and chew? I mean, like corn on the cob, things like that. A nice steak with 2 implants, securing?
They can certainly eat much, much better than they could before we put the 2 implants in.
Okay.
Again, you've got the 2 implants, so the denture still has a little bit of movement this way.
Right.
It's not as good as 4 implants where the denture has absolutely no movement whatsoever, but their chewing ability would be 1,000 times better.
Now, we talked on the phone, I thought it was very interesting, that you said if there was a try-in period in San Antonio where they could come in, the denture wearers, 2 implants, just try it for the weekend. If you don't like it, you say on Monday, nobody could go back to their loose-fitting denture. Do you believe that?
Absolutely. Now, I don't think one person out of a million would say, I don't like my denture fitting tighter. I don't like food not getting under it anymore. I don't like being able to chew better.
What do they tell you? I mean, give me some. I mean, what's the life of a denture wearer like? Because I know people with dentures, they never complain.
They don't complain to you. They complain to me because I'm the dentist.
Okay.
I mean, it's amazing how many people come into my office and say, I only wear this denture when I go out to eat or when I go out with friends because I don't want them to see me without my teeth. But most of the time, it's in my top drawer.
Really?
It's like a pair of shoes that doesn't fit very well and you've got to walk a long way in them. You hate them.
All right. But how old can you be? I mean, what's the upper range of people that do this?
You know, I hate to be vague, but there is no upper range.
Okay.
I mean, you can do it on a 90-year-old. If a person is 100 years old and still wants to chew well or chew better than they have.
So I guess really anybody's a kid. Are there people out there that think that they're too old to do this?
I'm sure there are.
My mother's 74 years old, she says, Randy.
Oh, she's a perfect age candidate.
She says her medical doctor said they'll fall out.
Yeah. Well, The medical doctor's not an expert on dental implants. He's an expert on her heart and her health, but he's certainly not an expert on dental implants.
Now with dental implants, your first case, you told me, your mother. Is that right?
That's right.
Tell me about that.
My mom had a history of periodontal disease all the time I was growing up. She was constantly going to the dentist, teeth getting loose. Once I became a dentist, I understood what was going on in her mouth. I started doing research on dental implants. And in 1985, when I started doing them, I said, Mom, you want some back teeth that you've never had other than that removable partial?
Okay, okay.
You know, she said, the price is right. I put you through dental school so you can put dental implants in for me. So I put 2 dental implants on this side. I put 2 dental implants on this side. I made her fix teeth that didn't come out. She had not had fixed teeth in her mouth for 20 years. And my mom died with those implants in her mouth.
Is that right?
It is.
So, I mean, did she like it? I mean, was it that much better?
Of course. I mean, it's the difference between having a prosthetic leg and your own leg. You know, a partial is the kind that has the little metal hooks and clips, and you eat and food gets underneath it and you have to take it out and wash it in the sink. When you put bridge work on dental implants, it's just like having your own teeth. You brush them, you floss them, you forget about them, you wake up in the morning, they're in your mouth.
Okay, okay. Categories of dental implant patients. Okay, so moving right in, and we already discussed there's thousands of people in I'm sure hundreds of thousands in Texas that have an upper or lower denture. What are their options?
Well, the option is to keep wearing the denture the way they have it.
Okay.
Put 2 dental implants just to help secure it. Put 4 dental implants to help secure it better. Or get rid of the denture completely with 4 or 6 dental implants and have fixed teeth that are cemented in your mouth just like a regular crown is cemented in, never taken out again, and you have teeth in your mouth that are just like you had when you were 18 years old that don't come in and out, no plastic, none of the stuff that's incorporated into a denture.
Now you brought models.
I did.
And one of the questions that, help me understand this. Okay, so why a dental implant, even if you're missing one tooth, over traditional dentistry?
Well, the biggest advantage over a single dental implant is, in the past, when you lost a tooth, what we typically did was we ground down the tooth in back of the space. We would grind down the tooth in front of the space. We would then make a 3-tooth bridge, which is nothing but a crown on the back, a crown on the front, a false tooth in between. We would then cement that in permanently.
Okay.
And that was a very good option, other than you had to drill down 2 perfectly good teeth.
Okay.
Okay. The alternative is we place a dental implant where the tooth is missing. We then make a crown that goes right into that dental implant. You've got a tooth that replaces your missing tooth, and nothing happened to your 2 perfectly good teeth.
Okay. Now for the denture wear.
Randy, for the denture wear, the most simple and most economical way to make the denture fit better is to put 2 dental implants with snaps. And as you can
Are you exaggerating a little bit here?
I'm a workout guy and I couldn't get it off.
Okay, okay.
Essentially what you have are 2 dental implants placed right here.
All right.
We then screw these 2 little snaps into the dental implant. You have 2 other little snaps inside the denture.
Just snaps right on.
And instead of that denture moving around like it normally does, it snaps on, and you can hear it.
Okay.
It's solid.
Okay. Could you ever make them too tight where they have a tough time pulling them out?
Yeah, we just have to adjust the tension in the snaps to accommodate the patient.
All right, so that's 2 implants.
That's 2 implants.
Snap in, snap out. No more adhesive in that particular case.
No
and
more.
You could eat with that.
Yeah.
Now, dentures, I always feel like I could spot a denture walking down the street. So people wearing dentures, can you, if you're going to make them a new one, can you make it look authentic?
Yeah.
Real?
I mean, we can certainly make it look better than a 20-year-old denture that they've been wearing forever.
All right.
We can naturalize it. You know, we can make custom shades. We can make the teeth a little crooked. We can make them perfectly straight. We can do a lot of things.
Okay, now what's the next level? Okay, so 2 implants for the denture wearers. What's next?
The next level is 4 implants. And actually, sorry, the airlines broke my model. My bags fly free, but apparently they had a fist fight.
Okay. Okay.
They broke on the way. But what this is 1, 2, 3, 4 implants, and this is a little bit of an old-time technique where we made a bar. Here's the 2 we put in the other case. Now we're putting 4. We can either screw teeth directly into those 4 so that we have totally eliminated the denture, or we can put snaps inside the denture to where the denture is then totally supported by the bar here instead of the tissue, and so the denture's not pressing on the nerve. It's not making sore spots in your gums.
Okay, okay. Now, you don't need the bar, you say also.
Don't need the bar.
Is that right? Not in every case.
Very few cases anymore do we use the bar. because most people, if they're going to spend the money to have 4 implants put in, they want fixed teeth. So we can put teeth directly on the 4 implants.
And do they feel like their own teeth? I mean,
sure they do.
And how soon can they eat? They come in, they get the 4 implants, they get a fixed set of teeth, or 6 implants.
The next day.
Is that right?
Yeah. Once the numbness wears off, then you can pretty much eat just like you normally did, except a lot better.
Is that right? Okay. Do patients ever say, come in with stories of what they're eating now?
Oh, sure. I ate a steak for the first time in 18 years. God, I can actually eat corn on the cob. I can eat fresh vegetables. So,
right. When you're 70 and 80, I mean, we interviewed a lot of medical doctors on the show, and they'll say you got to have a high fiber, you got to eat broccoli. Good luck trying to eat high fiber or vegetables, carrots, when you have a denture.
Yeah.
Is this like having their own teeth? I mean, do they feel?
Yeah.
Like, I mean,
it really does.
I mean, they could bite even better probably than they ever could, maybe.
They can bite as good as they could when they had their own teeth.
How long can they last?
Forever.
Is that right? Okay.
I mean, 95% if they make it to 1 year last pretty much forever.
I mean, the advertising in San Diego, and we're here in San Diego at our studio, and I hear, get a permanent set of teeth in just a few visits.
That's correct.
So this is an option for denture wearers to come in, get 2, 4, 6 implants to give them something fixed. Now the upper, we haven't talked about the upper denture, because isn't it true though the suction is good on the upper denture?
Yes, the upper denture fits much better than the lower denture does traditionally, but it also takes away a lot of your taste. We have a lot of taste buds in the roof of our mouth. So the thing that holds the upper denture in is the suction cup effect from the roof of your mouth, but then
good point, okay.
The thing that holds it in is also the thing that takes your taste away.
All right.
So if we place dental implants in the top, we can do 2 things. Obviously, we can give you fixed teeth like we talked about on the bottom, or we can cut your denture into a horseshoe and snap it in so that at least you have the roof of your mouth free so that you can taste things better.
Okay, interesting. Now you bought this bone thing. What is this? What is this? We have time just to show that. What is that?
This bone thing essentially just shows
that's a jaw. That's a lower jaw.
This is a lower jaw. Here it is when
Tilt
you're
it up just a little bit more. Okay, good.
Here it is when you're 18 years old and you have all your teeth. You see you have a nice big jaw. The day you get your teeth out, you still have a pretty big jaw. So a denture would fit fairly well, let's say, when it's got this much jawbone to hold on to. By the time you get to
over time, you're losing bone.
Absolutely.
If you wear a denture. Okay.
Every day you're losing bone.
All right.
When you no longer have teeth in your mouth to stimulate the bone starts to deteriorate away.
Okay.
Now you put a denture on top of that bone, and it's like sandpaper. You're wearing it away. You're wearing it away all day long.
Interesting.
So if you get dental implants,
now what about that lower one?
That
is it too late at that point?
No. And the reason I brought this model with the 4 teeth and the bar, it's to show people that their jaw that has deteriorated this badly. This little hole right here is actually where a nerve exits your bone and comes out into the open.
That's why it hurts.
Yeah, when your jaw deteriorates so much, see this hole used to be way down in your jaw.
Okay.
And that nerve actually comes out right there. So that nerve is sitting on the surface. Well, if your jaw is deteriorated this much, your denture every single day is pressing down on that nerve, making you hurt. So that's why some people want to get rid of the denture, something that's totally supported by implants. Well, yeah, because the pressure goes away.
Interesting. Now, what about people that have been told, my gums are too bad? They've been told all the teeth have to go. And somebody once told me, Randy, my gums are too bad, I can't get dental implants. What's your response to that?
Well, that's as far from the truth as you can get. Because going back to my model, if the gums are bad, you still have this much bone.
All right.
Okay? So let's say the bone has deteriorated all down here and you have to have your teeth out. Well, you still have this much bone, which is ideal amount of bone.
But what about the gums, though? The gums.
The gums are irrelevant. Once you take the bad teeth out, you take the source of the infection away. The gums heal.
Oh, good point. Okay.
So you take the teeth out, you place the dental implants, you've gotten rid of everything that was causing the infection. Your gums heal. They're perfect.
Interesting. So people, by the way, and this is a recap, we're out of time.
Okay.
But you say you're changing people's lives. It's more than just teeth. It's more than just dental implants. Elaborate on that.
So many people feel like they're happy on the inside, but they show the world a frown because they're miserable when they look at themselves in the mirror. They hate the way their teeth look. They hate the way their teeth feel. If I can give them a set of teeth that fits nicely, that looks great, it's going to change their persona. Okay. They're going to grow from the person who everyone thinks is a grump to smiling. I mean, people want to smile. And once you get teeth that you enjoy again, you enjoy eating. You enjoy going out in the public. I've had people who were overweight and they got a new set of teeth and it just reinvigorated them. They got their hair done different. They started wearing makeup. They started working out.
Good.
I mean, it just changes their lives.
Good. Okay, so pain is not something to be worried about. You have financing available because insurance, for the most part, doesn't cover the whole procedure, but you'll work with them. Okay, and it's about eating and chewing and feeling good about yourself. So the first move, somebody watching this, loose-fitting denture, what's their first move? What do you recommend?
I would recommend they just give us a call. We can get them in, we can do an examination, we can get the three-dimensional scan that'll tell us if they have enough bone. We can talk about the cost, we can talk about what to expect, how long it'll take. Cost nothing to come in and talk to me about it.
Good, good.
Explore your options. You'll be happy you did.
What are the frequently asked questions? They walk in, we're almost out of time, but frequently asked questions. What do they want to know every time they're there? Dental implant patient.
Mostly they want to know if I can make them more comfortable. Their denture's causing sore spots. They're tired of getting food under it. And the answer is yes. 100% of the time I can make them more comfortable. Even if they have osteoporosis, if they have diabetes, we can work with their physician. We have found that there are just very few patients who are not dental implant candidates.
Now we should mention this, how it's traditionally done, and you told me this, in dentistry, is you go to the surgeon that places the implant. Then you go to another dentist, maybe across town, that does the cap on the tooth.
Yeah.
And so you have two people involved.
Yeah.
And at your office, I guess you do both. You do the surgical procedure and you do the restoration.
I do.
Is that right?
I do.
And not everybody does it that way.
Not everybody does that. Most dentists do not have the skills to place the dental implants.
Is there an advantage?
Well,
in your
yeah.
opinion, that you do both?
Sure there is. You come into my office, you get to know me. You know where my office is. You're comfortable with my staff because we've already talked about how great they are.
You have the best staff in Texas.
I do.
According to you.
I do.
You really believe that. Okay, that's good. That's good.
I place the dental implants. Then I don't get a divorce from you and you go see another dentist and I forget about you and I never get to see you again.
Okay.
This way you're my patient. I get to know you. I get to care about you. I place the dental implants. I watch the healing process. I then put the snaps in. I then put the things in your denture. And I get to guide you through the whole process.
So we're completely out of time. Final message though. Is there anything we didn't talk about?
We didn't talk about the opportunity for the patient to be sedated when they come in to get the work done.
Okay.
Many people are so nervous. I mean, I'm not talking about just dental implants. They're nervous to get a filling. They're nervous to get a root canal. They're nervous to get their teeth cleaned, some people. We can give them oral sedation where they take some sleeping pills 1 hour before their appointment. They get nice and sleepy. Once they're sleepy.
So you have a special license for this oral sedation?
I do.
Okay, okay.
Been doing it for about 20 years.
So don't let anxiety also keep you from doing this.
Right. Also, don't let the cost deter you. The car dealerships have made a great living finding a way for you to make monthly payments on your car.
All right.
You can make monthly payments on your dental implants. It'll change your life more than a new Chevrolet will.
All right, good. Well, thank you for coming on the show. Very interesting.
Thank you.
Pleasure to have you on the program. You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again on our website, just put in Dental Implants San Antonio, or you could put Dr. Jacobs on there, Dental Implants. You'll find them there. For now, I wish you good health.